Hi PT friends and PT students. I'm coming to you today with a video resource that I hope will be helpful to you. I know since we have had this COVID-19 outbreak and are under precautions that as PTs we're seeing many fewer patients, so maybe our manual therapy hands-on skills are getting a little bit rusty, and then as students, maybe in manual therapy courses, we don't have the practice reps that we want to develop these skills. Not as much hands-on time, stuck at home, studying textbooks. So I wanted to share with you today some tips on how to get more reps and practice with manual therapy throughout your day and not having access to those clinical patients or practice class repetitions. So here's how I go about my day and get my manual therapy reps in. So when I wake up, I'm gonna stretch, check out my functional external rotation. Oof, little bit tight there. I'm gonna have to self-mob that shoulder, I think. And then, a little stiff through the neck. Got a cavitation though, score. So a little self-cervical manipulation. And then, as I walk into the kitchen, I'm thinking about breakfast. What other resources do we have that can help us study? Well, we'll take a quick detour by the closet. What might we have in here? Oh, hello, Mr. Skeleton. So even though you don't have access to people, human beings, we can still think about the relevant anatomy for all of our manual therapy skills. So for example, the scapular plane is what we're going to want to mobilize that glenohumeral joint in, and that's important to note that it's not a direct, not directly in the sagittal plane, but we're a little bit off that plane when we do our glenohumeral mobilizations. We can also think about the orientations of the spinal facets and review our anatomy, whether it's on Mr. Skeleton or an anatomy textbook. So if we come on over into the kitchen, I'm going to let him take a seat. He's kind of done his job for today. And we think about our spinal facet orientations, remembering that our cervical facets are at about 45 degrees from that coronal plane. Moving into the thoracic, we're at more of a vertical orientation, so 60 to 90 degrees roughly as you go down your thoracic. And then those lumbar facets are more in a sagittal plane orientation. So as we review those are going to help us think about how much motion is going to be at each spinal segment, and it's going to help our manual therapy knowledge as a whole. The other thing I want to do always before I get studying and really hitting the books is I need a little bit of fuel for my day. And I like to practice my HVLAs. So I'm going to come over here, grab a banana. And this is one of my favorite techniques for practicing our HVLA or grade 5 mobilization. So you're going to place your hands close to the banana joint because that makes for the best manipulation. You're going to take up that tissue slack, get to end range, and quick thrust. Look at that. Okay, so not only do I have some good HVLA practice, but now I have some breakfast. All right, so, well, I'm going to eat that later. First, I need to hit the books. So here we go. We have our manual therapy references. So we got Kaltenborn, Maitland, and then one of our orthopedic founding fathers, Syriacs. And you're probably saying, Leda, well, how are these textbooks going to help me? I'm already reading plenty. I don't need to read about manual therapy. I need to do manual therapy. Well, here we go. Here's how you use these textbooks and really get some hands-on practice. So I got my dish towel here. I'm going to place my dish towel over my patient, my first patient. And this is a soft cover book, so we're thinking probably good mobility here. And we're going to sit up just as we're doing a spinal mobilization. So I'm going to utilize a cross-hand technique. I'm going to get over my patient, and I'm going to take up that tissue slack, get to end range, and I can perform some grade 4s for treatment. I can assess motion. So Kaltenborn feels moving pretty good. Maitland, let's see how the spine of that book is feeling. Get it? It's fine. Yeah, pretty good mobility. Okay, and then Syriac, so this is a hardcover book. I'm thinking, ooh, this patient is moving stiffly. They look stiff. Oh man, sure enough. So this is going to take some grade 3s or grade 4s to really get the change in motion that we need. So I'm going to be a little more aggressive. I'm going to hang out at end range for those grade 4s. Might even need a manipulation. So I'm going to get patient consent. Are you okay with the manipulation? Yep, so patient consent. And then I'm going to take up that tissue slack, get to end range and quick thrust. There we go. Did you hear that cavitation? That was a good one. Okay. So I've hit my books. What else can I do to practice my manual therapy techniques? Well, I had a professor once say that in order to be a good manual therapist, you need to have really good tactile sensation. And so one of the ways to practice that is you need to be able to feel the nose of George Washington on a quarter without looking at it. And so let's check that out. So I got my quarter, and as you can see, that nose, where's my camera? That nose is pretty small. So I'm going to work on that. So I'm going to put that quarter in my pocket. And when I'm pretty confident, kind of move it around. See if I can get the nose. Okay, not bad. Give myself some practice reps. And you'll get better at that. Honestly, if you do that, that skill will really improve. And you can train your finger sensation. At least get good at detecting front versus back. That's kind of your first task. As you get good at that, some students and therapists might stop there, but for anal ones who really want to get good and give themselves a challenge, and also because of the COVID-19 precautions, we're going to make it a little bit more difficult. We're going to grab our glove. So we're going to glove up for safety. Money is dirty, and also we want to have a little bit of a barrier between us and our patients. So I'm going to place that coin in my pocket, and I'm going to practice with a little bit of a barrier and try to find the nose. Okay, so I got the right side. I'm not quite on the nose. Needs a little bit more practice. All right, well, at least we're staying safe. So I hope these tips helped you out, maybe with a few laughs or maybe just with some ideas to get creative with your studying. Really, truly stay safe, you all, and best of luck. I know this provides different hardships for different people, but at the end of the day, give yourself a high five that you are still engaged and studying and thinking about PT, doing the best you can, and best of luck.